Hi, let's talk about the ethmoid bone. Another cranial bone. It has a small amount of contact with the brain. So the first slide, we're looking at a sagittal section of the skull. The Crista Galli is shown with the yellow box and the black arrows. And the ethmoid bone is all of the gray bone. And the top view shows the ethmoid bone with the perpendicular plate intact, a piece of it. In the bottom view, the ethmoid bone, still the gray colored bone, with the perpendicular plate removed. So the bottom view is a more lateral view of the nasal cavity, and the upper view is sort of a medial sagittal view with the bony nasal septum intact. So the Crista Galli is just this little shark's fin, if you will, that sticks up at the top. It anchors part of the dura mater for the brain, keeping the brain in place. The lower figure we'll go through later, but this is an introductory slide showing the Crista Galli. Superior view, a couple of things. The ethmoid bone is a cranial bone because of this portion of it that is on the floor of the cranial cavity. So that's the superiormost portion of the ethmoid bone, the Crista Galli. You're looking straight down on the shark's fin, if you will, which I'm highlighting in yellow. And sort of looks like a little rooster comb. I think that's how it got its name. A couple other things, the Cribriform plate. So these are all features of the ethmoid bone again. So we've talked about the Crista Galli, that little fin that sticks straight up, and then the Cribriform plate and the olfactory foramina. So the Cribriform plate is just a flat horizontal piece of the bone on the floor of the cranium, and it has all these holes in it. It's called the Cribriform plate because of the holes. And I don't know if you play the card game cribbage, but the bottom left is a cribbage board. Sort of looks like the Cribriform plate of the ethmoid. I don't know why my marker isn't working. There we go. So the little holes are what you put the pegs in, and that's how you count points in the card game cribbage. So that's a Cribriform board, or a crib board, and here's the Cribriform plate of the ethmoid. And the tiny little holes are what allow for the first cranial nerve to pass through, cranial nerve 1, which are the olfactory nerves. So the olfactory nerves pass through the olfactory foramina. Okay. Next slide. Another view of the perpendicular plate of the ethmoid, gray colored on the figure on the right. This is bone, and it hooks up inferiorly with the vomer, and those two bones, the ethmoid bone and the vomer, form the bony nasal septum dividing the right and left nasal cavities. Similar view on figure on the left, showing the perpendicular plate of the ethmoid, and the vomer isn't really delineated in that figure. A couple of things that you might note: there is a nasopalatine nerve. We will come back to that. Don't worry about it now. Here are the olfactory nerves, and these are cranial nerve 1, first one. And they pass through the foramina. of the perpendicular plate. Next slide. Anterior view, you can see the perpendicular plate. It's labeled, and it's made up of the perpendicular plate of the ethmoid and the vomer. So the vomer and the ethmoid make up that bony nasal septum. But the perpendicular plate is a feature of the ethmoid. Also, feature of the ethmoid are these middle nasal concha that you can see here. And there's another one on the other side. Those are part of the ethmoid bone, not the inferior nasal concha. That's a facial. Those are facial bones. Similar view of the ethmoid again. Top view showing the perpendicular plate, medial. If that perpendicular plate is chipped away and removed along with the vomer, you see the bottom illustration. Still gray. Perpendicular plate's been removed. And this is showing the superior nasal concha and the middle nasal concha. It's the middle nasal concha that were visible in the previous slide. And the inferior nasal concha are facial bones. But the gray is the ethmoid. Next slide. Back to a view of the orbit. And most of this you should recognize. Most of this we're going to cover. I do not talk about the ethmoidal foramina. Everything else on there is probably okay. And you recognize that this large foramen, and you can tell me what passes through it. So back to the ethmoid, there's the orbital plate on the left, medial wall of the orbit, shown on the right-hand figure, which is a coronal section, anterior view through the ethmoid, well, through the skull. And here is the orbit. And you should be able to identify that opening. Tell me what passes through it. And you should be able to identify that opening. We haven't yet talked about what passes through the lower opening. Here is the perpendicular plate again of the ethmoid. You can see the two nasal passages. This is an anterior view. So you're looking in from the front, going out posteriorly are the two large nasal passageways. And here is the nasal conchae, the inferior, which is a facial bone, and then the middle, which is part of the ethmoid. And you should be able to recognize this little top knot. A little piece sticking up. And that's it for the ethmoid bone. So I would spend a little bit of time on this slide and just spend some time with it. We'll be coming back to it with facial bones. Okay, see you soon.